Good day, everyone, and welcome to today's webinar on the 2026 Medicare landscape and anticipated changes ahead. My name is Andy Furman, and I'm here to guide you through the current Medicare environment and how your coverage may be impacted. Understanding potential changes will help you prepare as you review your coverage in the upcoming annual enrollment period, which runs from October 15th through December 7th. The goal of this presentation is to educate you so that you have a plan for the upcoming annual enrollment period. All Medicare recipients should have a trained, licensed, independent agent that is knowledgeable about all the plans offered in your area. Your agent should be knowledgeable in supplemental or Medigap plans, Part C Medicare Advantage plans, as well as standalone Part D prescription drug plans. Your independent advisor should also be well versed in ancillary protection plans such as cancer, critical illness coverage, home and short recovery care, and lastly, hospital indemnity plans. Your agent should be local and have advanced training in drug saving strategies to help you navigate the complexities of prescription drug plans. In August of 2022, the Inflation Reduction Act was signed into law, bringing several key changes designed to lower prescription drug costs for Americans. At the same time, insurance companies are facing higher claim payouts and a shifting reimbursement environment. As a result, many in the Medicare planning industry anticipate significant disruption moving into the 2026 plan year and beyond. Today, we'll focus on what that disruption may look like and how it could affect your coverage moving into the next year. To set the stage, we'll briefly start with a quick look back at the history of Medicare prescription drug coverage. We'll then review the additional challenges facing Medicare plans and why these changes may impact your coverage and options. Next, we'll dive into potential challenges across supplemental Medigap plans, standalone prescription drug plans, and Medicare Advantage plans. Finally, we'll close with how to review your annual notice of change, what to look for, how to spot if your plan has changed for the upcoming year, and what you can do about those changes. Medicare's prescription drug coverage has evolved significantly since its inception, with major milestones including the introduction of Part D in 2006 and ongoing reforms aimed at reducing the financial burden of prescription drugs for Medicare beneficiaries. The 2025 changes under the Inflation Reduction Act represent the latest in a series of efforts to improve affordability and predictability of prescription drug costs under Medicare. The Medicare Modernization Act of 2003 created optional prescription drug plans for those on Medicare starting in 2006, and the program has been largely unchanged since its introduction 18 years ago. The Inflation Reduction Act of 2022 introduced perhaps the most significant changes in Medicare since prescription drug plans were launched back in 2006. First, starting in 2023, the Inflation Reduction Act capped insulin at $35 per month for covered insulins. And then in 2024, the 5% cost sharing in the catastrophic phase was eliminated. Beginning in 2025, the coverage gap, or what was commonly known as the donut hole, was eliminated. Instead, there was a maximum out-of-pocket placed on covered prescription drugs. Starting in 2025, there is now a $2,000 maximum on what Medicare beneficiaries will pay out-of-pocket for their covered prescriptions. This new cap eliminated what we used to call the donut hole. In 2026, that maximum out-of-pocket will increase slightly to $2,100. Before 2025, some Medicare beneficiaries were paying $5,000 or $6,000 or even more in copays at the pharmacy. So for those who fell into this group, the new $2,000 cap saved them a tremendous amount of money. But here's an important detail. Only about 10 to 11% of Medicare beneficiaries ever reached that coverage gap in the first place. So the question becomes, if somebody who used to pay $6,000 is now capped at $2,000, who is covering the other $4,000? Let's take a look. On your screen, you'll see a chart that compares cost sharing before the 2025 changes with what happened starting in 2025 and will continue into 2026. Prescription drug costs are shared among several parties. Prescription drug costs are shared among you, the Medicare beneficiary, the federal government, the insurance company, and drug manufacturers. In the chart on your screen, the pinkish coral represents you, the Medicare beneficiary. The dark blue is the insurance company, the light blue is the pharmaceutical company, and green represents the federal government. Here's how it works. In both 2024 and 2025 and moving into 26, during the deductible phase, you pay 100% of the cost if your prescription has a deductible. There's no change here. In the initial coverage phase, you currently pay about 25%, or prior to 2025, you paid about 25% through copays and coinsurance. The insurance company covered the other 75%. But starting in 2025 and moving into 26, the insurance company's share drops to about 65%, and the drug manufacturer picks up the remaining 10%. Your 25% remains the same. Now, here's where things get interesting. Prior to 2025, when somebody entered the donut hole, that Medicare beneficiary paid 25% of their prescription drug costs. The insurance company only paid 5%, and the drug manufacturer picked up the other 70%. Now, starting in 2025 and moving into and continuing into 2026, that changes dramatically. The insurance company's share jumps to 60%. That is a massive increase. And realistically, it's not one the insurance companies are going to absorb by themselves. Why does this matter to you? Remember, only about 10 to 11% of Medicare beneficiaries ever hit the coverage gap. So if the insurance companies are suddenly on the hook for 60% of those costs and the government and the pharmaceutical companies are actually paying less, where is that money going to come from? It may very well come from the other 90% of people who never enter the coverage gap. And how do the insurance companies pass along that cost? They only have a few levers to pull: higher premiums, higher copays and deductibles, stricter prescription formularies, and fewer benefits. Before we look at how cost sharing increases get passed along to you, the Medicare beneficiary, there are a couple of additional factors adding stress to today's Medicare marketplace. As we discussed in the last slide, the Inflation Reduction Act changes to prescription drug coverage increased and shifted cost to the insurance companies. Insurance companies are also seeing more people using their plans. A big driver is delayed care from the COVID years. Many people put off elective procedures or skipped routine care, which led to undiagnosed conditions. Now we're seeing a wave of procedures being performed all at once. On top of that, many people approaching age 65 are delaying elective procedures until they enroll in Medicare, especially if their current coverage has high deductibles. They're delaying this care in elective procedures because their cost share may be significantly reduced or eliminated once they're on Medicare. This surge in claims directly affects the medical loss ratio, which is simply a measure of how much an insurance company pays out in claims compared to how much it collects in premiums. When claims go up, premiums must also go up. Finally, Medicare Advantage plans are also under pressure because the government has reduced the payment it provides to the insurance companies. This creates additional strain on plan design and pricing. Insurance companies don't just absorb rising costs. They pass them along to you, the Medicare beneficiary. The main levers they can pull include higher premiums, higher copays, higher coinsurance, and higher deductibles. They may also reduce benefits and create stricter prescription drug coverage. Because costs are climbing, insurance companies are taking a hard look at plan profitability. For plans already running on thin margins, this can mean plan withdrawals or plan terminations. Last year, for 2025, we saw WellCare exiting the Medicare Advantage space in many states, including Massachusetts, New Hampshire, and Rhode Island. Mutual of Omaha exited the prescription drug plan market across the country. Several other insurance companies also consolidated their prescription drug plans, which significantly reduced the number of available plans. Looking ahead, we anticipate further reductions in both Medicare Advantage and standalone prescription drug plans. Another lever the insurance companies can use to contain their cost and pass the cost on to you, the Medicare beneficiary, is through their formulary, or what is simply a list of drugs your plan covers. To control cost, insurers may stop covering certain prescriptions altogether, and they may add new utilization tools such as prior authorizations or step therapy where those utilization tools didn't exist previously. Finally, even so-called zero premium Medicare Advantage plans are not immune. We may see new monthly premiums introduced, higher cost sharing through copays and coinsurance, as well as reductions in the extra benefits such as dental, vision, or over-the-counter benefits. While the federal government gave insurance companies some temporary relief for 2025 and extended a portion of that into 2026, we still anticipate to see rising premiums on standalone prescription drug plans. We also anticipate higher copays and coinsurance. Even Tier 1 and Tier 2 prescriptions, which in the past may not have had a copay at all, could now carry a copay in 2026. On top of that, we may see stricter formularies, meaning fewer drugs covered, and more utilization tools like prior authorizations or step therapy before the insurance company will pay for certain medications. This is why it's especially important to review your plan going into 2026. The plan that worked well for you this year may look very different next year. And if you don't review your options during the annual enrollment period, you could be stuck with a plan that no longer fits your needs for the entire year. Finally, if your insurance company consolidates or discontinues a plan, they may move you into a different plan automatically. But remember, the plan they choose for you might not be the most suitable one for your situation. Let's talk about Medicare supplement plans or Medigap plans. Premiums for Medigap Medicare supplement plans have been climbing steadily throughout 2025, and we expect those increases to continue. The main drivers are higher overall claims and something called the medical loss ratio, or MLR. So what exactly is the medical loss ratio? In simple terms, it's a measure of how much an insurance company pays out in medical claims compared to how much they collect in premiums. For example, if a company collects $100 in premiums and pays out $80 in claims, their MLR is 80%. We're seeing many Medicare supplement insurance companies have MLRs greater than 100%. This means they are paying out more in claims than they're taking in premiums. Why does this matter to you? As claims rise, insurers reach their MLR thresholds more quickly. To stay compliant with federal requirements, they have to adjust their pricing. And in the supplemental space, the only lever they really have is to raise your premium. The bottom line is this: even if your own health hasn't changed, your premium can still go up because of what's happening across the entire pool of insured members. That's why it may make sense to review your current plan and compare it to similar plans offered by other insurance companies. The good news is with Medigap, you typically can make that change at any time throughout the year. You do not always have to wait for the annual enrollment period. And as you're reviewing your supplemental plan, it's also a good opportunity to look at your ancillary coverage, things like dental or vision, or even a cancer, heart attack, or stroke policy. This is to make sure that your overall protection is still a good fit. We're also seeing a lot of changes in the Medicare Advantage marketplace. First, expect to see more plan terminations. If your Medicare Advantage plan is discontinued, you'll have the opportunity to pick a new plan during the annual enrollment period or during a special enrollment period that follows. But if you don't make a choice, you may be left without another Medicare Advantage plan. You may not automatically be assigned a new one. In fact, you'll likely automatically revert back to original Medicare Parts A and B. And that means you'd be subject to Medicare's deductibles, copays, and coinsurance. And unless you separately enroll in a Part D prescription drug plan, you could also lose your prescription drug coverage. Second, we expect the introduction of monthly premiums, especially on PPO plans. For years, many Medicare Advantage plans have been marketed as zero premium, but rising costs are making that harder for insurance companies to maintain. So it's likely we'll see more plans adding a monthly premium. Third, we anticipate increased copays, deductibles, and coinsurance. Even if your plan premium stays the same, your share of the cost when you actually use the plan may go up. Fourth, many of the extra benefits may shrink. A big draw of Medicare Advantage plans has been ancillary coverage, things like dental, vision, hearing, gym memberships, or over-the-counter allowances, only to name a few. As costs rise, insurance companies may reduce or even eliminate some of these benefits. And finally, we anticipate network consolidation. Both HMO and PPO plans are narrowing their provider networks, meaning fewer doctors and hospitals are considered in-network. This can limit your choice for care. So what does this mean for you? It means you may need to think about layering in additional protection. If your Advantage plan trims back benefits, you may want to consider adding separate dental or vision coverage. If you're concerned about out-of-pocket expenses, you might look at protection plans. A cancer, heart attack, or stroke plan can provide cash benefits if you face a serious diagnosis. A hospital indemnity plan can help offset the cost of hospital stays by putting money directly in your pocket. These plans act as a financial safety net, helping you fill the gaps when Medicare Advantage coverage falls short. The bottom line is this: Medicare Advantage can still be a good option, but the landscape is shifting. Reviewing your plan each year and considering protection plans to work alongside your Advantage plan is more important now than ever before. Every year, your insurance company is required to send you what's called an annual notice of change, or ANOC. This is sent for both prescription drug plan members and Medicare Advantage members, and it is supposed to arrive in your mailbox no later than September 30th. When you get this package, don't just toss it aside. It's one of the most important documents you'll receive with regard to your healthcare coverage. The best place to start is the summary page. That's where the big changes are listed. Here's what you want to look for right away. Premium increases. Is your monthly cost going up, or is a premium being added for the first time? Changes in the maximum out of pocket. This number tells you the most you could spend in a year, and if that maximum out of pocket is higher than it was in previous years, your financial exposure is higher. Cost sharing changes. Check for new or higher copays for doctor visits, emergency room or urgent care, ambulance rides, or inpatient, outpatient hospital stays, among others. Ancillary benefits. Look at things like the dental, vision, or the over-the-counter allowances, things like fitness or wellness perks. Have any of these been reduced or eliminated? And finally, check for formulary changes, meaning is your prescription drug still covered? In doctor network changes, are your preferred doctors or hospitals still in network? The ANOC is essentially your warning letter. It tells you if the plan you have today will still be a good fit for next year. If you don't review it carefully, you could find yourself paying more or losing benefits without realizing it until it's too late. So let's talk about what happens if your Medicare plan is terminated. If your prescription drug plan or Advantage plan is terminated, what happens? Well, first, the insurance company will send you notice. Now, the insurance company may do what we call crosswalking you into another plan that they offer. That means they'll move you into what they consider to be the closest option available. Other times, you'll simply receive a notice of termination with details outlining other plans in your area. But the responsibility for you to enroll in a new plan is solely on you. Next, the enrollment deadlines. If your plan is ending, you can pick a new plan during the annual enrollment period, October 15th through December 7th. There is also a special enrollment period from December 8th through February 28th. That gives you another window to make a change if you miss the fall deadline. But here's the key part. What happens if you don't enroll in a new plan? If you don't pick a new plan, you'll automatically default back to original Medicare Parts A and B. That means you'll be responsible for Medicare's deductibles and coinsurance. And importantly, you'll run the risk of going through 2026 without any prescription drug coverage. Finally, let's talk about Medigap options. In certain situations, if your plan terminates, you may have a guaranteed issue right to enroll in a Medicare supplement or Medigap plan without having to go through medical underwriting. That can be an important safety net if you want to make sure you're covered. As we've seen today, there are a lot of changes coming or anticipated. We anticipate rising costs, shifting plan designs, and potential reduction in benefits. We won't know exactly what those changes are until October 1st. The most important takeaway today is this: don't wait until it's too late. Come October 1st, take the time to review your plan and make sure it still fits both your healthcare needs and your budget. The best way to do that is by working with a licensed independent broker, someone who knows all the plan options available in your area and can walk through the pros and cons of each. And here's something many people don't realize. There's no extra cost to you. Whether you go it alone, call the insurance company directly, or work with a broker, you pay the exact same premium for the exact same coverage. The difference is, with an independent broker, you get an advocate in your corner, and the consultation is always free. So don't wait. Anticipate the need to review your plan for 2026 now. The annual enrollment period runs from October 15th through December 7th, and appointments will fill up fast. Book your free consultation today and make sure you're ready for 2026. Thank you for participating in today's webinar. The message here is not that the sky is falling, but if you're not prepared, you may face some surprising changes when the new year arrives. That is why it's important to take the time now to review your options and make sure your coverage aligns with both your healthcare needs and your financial wellness. Please don't hesitate to reach out if you'd like to create a partnership for your health coverage and financial wellness. Remember, it's your health, it's your wealth. Worry less, heal more. Until next time, be well and be healthy.